Today, we're going to talk about a condition called Polycystic Ovary Syndrome, or PCOS for short. And while that name makes you think it's all about the ovaries, the reality is so much bigger. It's a condition that affects a person's health in ways a lot of us don't realize, and it is incredibly common.
How common are we talking? Well, take a look at this. Worldwide, 1 in every 10 women of childbearing age is affected by PCOS. Just let that sink in for a second. In any group of 10 women you know, friends, family, coworkers, statistically, 1 of them is navigating this really complex, lifelong condition.
So to really get a handle on its impact, we're going to follow what I'm calling a ripple effect. We'll start right at the very core of the condition, and then we'll trace how it expands outwards, affecting just about every aspect of health, from the things you can see on the outside to the hidden long-term risks deep inside.
Okay, so what is really going on here? Well, the first thing to understand is that the name PCOS can be a little bit misleading. This isn't just about cysts on the ovaries. At its very core, it's a complex endocrine disorder, and it's all rooted in a deep hormonal and metabolic imbalance.
And this definition really gets to the heart of it. PCOS is basically driven by 2 key issues that work together. First, you've got that imbalance of reproductive hormones, which leads to higher than normal levels of androgens. You might know them as male hormones. And second, and this is absolutely crucial, there's insulin resistance. This means the body just can't use insulin the way it's supposed to, which sets off this whole cascade of effects we're going to see.
So this is where the name polycystic actually comes from. If you look on the right, you can see a polycystic ovary. But here's the thing, those small sacs aren't dangerous cysts in the way you might think. They're actually underdeveloped follicles, and each one is holding an egg. Because of that hormonal imbalance we just talked about, these follicles can't mature properly and release their eggs. This failure to ovulate is a central piece of this whole puzzle.
All right, let's move to that first ripple and see how this internal imbalance starts to show up on the outside. These are often the very first clues that make someone think, maybe I should get this checked out, because they're the ones you can physically see and feel.
Now, what's so important to see here is that all these visible symptoms are direct results of those internal imbalances we talked about. It's not random. Those high androgen levels, that's what can trigger things like acne and excess hair growth. And that insulin resistance, it's a major reason for weight gain, especially that stubborn kind right around the abdomen. It's literally the internal issues showing up on the outside.
This quote is so important because it highlights that these symptoms are way more than just skin deep. They are physical signs of a huge systemic issue, and having to manage them day in and day out has a profound impact on self-esteem, body image, and a person's overall quality of life.
This brings us to our second ripple, the impact on fertility and pregnancy. This is probably one of the most well-known aspects of PCOS, but it's also one of the most stressful and, honestly, one of the most misunderstood.
For so many women with PCOS who are thinking about starting a family, this is the big looming question. How exactly does this condition get in the way of getting pregnant?
It's a direct chain of events, really. It all starts with those high levels of androgens. They mess with the delicate hormonal signals that are needed for an egg to mature and be released. So when that release doesn't happen, there's no ovulation. And without ovulation, well, conception is simply impossible. This is exactly what makes PCOS a leading but often treatable cause of infertility.
But the challenges don't necessarily just stop once conception happens. For women with PCOS, the pregnancy itself is considered high risk, and it comes with its own set of potential complications.
And these risks are significant. Studies show that pregnant women with PCOS face a much higher chance of some pretty serious complications. We're talking about a greater risk for gestational diabetes, and they are 56% more likely to develop preeclampsia, which is dangerously high blood pressure. On top of that, they face higher risks for heart issues and blood clots during delivery. It really just underscores why these pregnancies need such careful monitoring.
So let's move to our third ripple, which looks at the hidden long-term consequences. These are the risks that can develop over a lifetime, and they stem directly from that metabolic chaos that PCOS creates inside the body.
Right, so here we are again, back at the central engine driving so many of these long-term problems. That same insulin resistance we mentioned at the start. This is the invisible part of PCOS that can have the most serious impact on a person's health as they get older. This chart just lays out how much higher the risks for other serious health problems become. I mean, look at this. Up to 20% of women with PCOS will develop type 2 diabetes. The condition also raises the risk of high blood pressure and high cholesterol, which, as we know, are major drivers of heart disease. And because periods can be so infrequent, the uterine lining can thicken over time, which significantly increases the risk for endometrial cancer.
And that brings us to our final and perhaps most overlooked ripple: the absolutely immense psychological and emotional burden of living with PCOS. This isn't just some side effect. It's a core part of the whole experience.
I mean, just imagine managing unpredictable periods, visible symptoms like acne and hair growth, constant challenges with your weight, and the profound stress of infertility, all at the same time. This constant battle can take a huge toll on your mental well-being, leading to significantly higher rates of anxiety, depression, and just poor self-esteem.
This number is just staggering. Some studies report that up to 64.1% of women with PCOS experience depressive disorders. When you really think about the constant management of physical symptoms, the body image issues, the potential fertility struggles, it becomes so clear that this isn't just a physical condition. It's a mental health crisis that's completely tangled up with a physical one. And it's exactly why psychological support is so vital.
So after exploring all these ripples, the most important question is, what on earth can be done? Let's shift gears here to a more empowering perspective and look at how PCOS and its many effects can actually be managed.
Okay, so while there's no cure for PCOS, management really rests on these 3 pillars. Lifestyle is the absolute foundation. Even small changes to your diet and exercise can dramatically improve how the body uses insulin. Then you've got medical support to target specific hormonal issues, like regulating your cycles. And crucially, to address that final ripple we talked about, psychological support has to be part of the plan to manage the anxiety and depression that so often come along for the ride.
And this right here is the ultimate takeaway. Effective PCOS management is not about just treating one symptom at a time. It requires a holistic, lifelong plan that sees the whole person, addressing the reproductive, the metabolic, and the psychological aspects all together as one.
Which leaves us with this final thought. Knowing just how profound and multifaceted PCOS is, the real question is for all of us: how can we build more awareness, demand better, more integrated care, and just offer more empathy to the 1 in 10 women who are navigating this every single day?